Hello friends, in this video we will discuss about a must know topic for in microbiology for MRB exams. Okay, so as you will be revising all the topics including general bacteriology, but you must not skip these topics. So in general microbiology, don't miss the scientist in microbiology, that is the contributors. As you know, like father of microbiology is Louis Pasteur. So it is a first chapter in microbiology. So you must not miss any single scientist from that. So second, it is a strains in microbiology. Coming for strains, as you know, there is a differential strain, simple strain, negative strain. I think you want to know about all these strains and what are the dyes they have been used and what are the organisms that can be strained. Okay, and there is a strains in microbiology. I'll be uploading the link in the description box. Kindly go through that. And next, you want to know what is the types of flagella like monotrichous, lopotrichous. Please don't skip that topic too. And coming for motility types, you know, like tumbling motility in listeria. I think there is a list of 10 motilities. And what are the list of capsulated organism? And then bacterial growth curve. Okay, so bacterial growth curve is an important topic which consists of a lag, log, stationary phase and a decline phase. Okay, so you must know each and every point in this. And coming for sterilization and disinfection, just you want to know the classification. Okay, like what is a dry heat, what is a moist heat. The important is the temperature. So temperature for autoclave, hot air oven, it's a must known point. And coming for sterilization control, as you know, it is for the to see the efficacy of the sterilization method. So we'll be using some of the indicators like Bacillus niger, Clostridium tetani. So you want to know that. And symptoms in microbiology. Okay, so symptoms in the sense like Waterhouse-Friderichsen syndrome in Neisseria, and congenital rubella syndrome is there, and so there are n number of syndromes. Okay, so and then so you want to know every point in that. And signs in microbiology. Okay, so what are the signs is like Kerendal sign seen in trypanosomas. So water lily sign is seen in hydrated cyst. So if you come across these words like what are the signs, symptoms, you can just make a separate note of it. So coming for immunity, you want to know what is super antigen, and compulsory you want to know about what are the examples of super antigen and types of antibody. I know GAMD, right? GAMDE. In that you want to know like what is the half, which have the maximum half-life, shortest half-life, which is abundant intravascular and extravascular, which is elevated in the respiratory tract infections, which will be elevated in the Helminth infection. And so these are the important point. And regarding precipitation agglutination test, you want to know the examples, like example for slide agglutination, tube agglutination test will be there. So friends, I am not going in detail because you will be having an enough notes. So go through these topics, that is more than enough. And complement deficiency disorder is like hereditary angioneurotic edema in estrase deficiency. So kindly go through that. I think there's a 5 diseases under this complement deficiency disorders and immunodeficiency disorder. Okay, so this is important like primary immunodeficiency, Viscato-Aldrich syndrome, ataxia, telangiectasia. So there is a video for this in my channel. I'll be giving a description box, so kindly go through that. So coming for hypersensitivity reactions, yeah, 4 hypersensitivity reactions, presently 5 have been developed. So in that examples is important. Okay, so coming for bacteriology, you want to know the selective medium for all the bacteria. And as I know, the scientist in microbiology is important, right? And there are names of the bacteria which have been named after the scientist. Okay, like Edward Silla, it's been named after Edward, like that. So what are strains in vaccines like BCG Danish strain is used, and Park Williams strain is used for Corynebacterium diphtheriae. So you want to know that. Test in bacteriology. So this is a broad term, friends. Like either all the tests you want to know, like string test is there, Fairley test is there, and you don't need not to confuse everything. And so Fevers in microbiology, again it is an important topic. And cultural characteristics is nothing but like if you come across Staphylococcus aureus, it will be producing golden yellow pigment. If you come across Bordetella, it will be producing a thumbprint appearance. Okay, so like that. So then you want to know which is a gram-positive cocci, gram-negative cocci, and negative bacilli and positive bacilli. Okay. So coming for the virulence factor, there is some of the important and specific virulence factor for all the organism. So you want to go through that also. And coming for virology, you want to know the shapes of virus. So classification, which is a DNA virus, which is a RNA virus, and which is single stranded and double stranded, and cytopathic effect. Okay, so it is an important like the clusters. There will be granation will be there, and then grapes of clusters appearance is seen adenopathic adenovirus. So incubation period of disease, again it is an important point, and there is a video in my channel, and I'll be giving a description box. Okay, so coming for inclusion bodies, again it is an important topic. So in both the virology and some of the bodies will be present in the bacteriology too. So coming for mycology, friends, in this you want to read everything like so you go through the disease and what is the specific pattern, and some cultural characters will be there like fried egg appearance in Tinea versicolor, okay, and splendor Hoblish phenomenon like that. So just go through that. And coming for parasitology, you want to know the bile and non-bile stained eggs, operculated eggs, the eggs which floats in saturated salt solution. And coming for the parasites causing anemia, myocarditis, and travelers diarrhea. Okay, so what are the parasites causing autoinfection? And then habitat, that is a parasites where it will be residing, that is it can reside in large intestine or the small intestine. So just make a tabular column for that, or it's more than enough for that. And this is important topic, friends, neurocystic sarcosis, which will be seen in the tinea, and larva migrants. Okay, so another important topic here is I want to mention 3 tabular column, friends. So one, it is in biomedical waste management. Second, rickettsial infections. Okay, and third, it is in rickettsial infection, that's a tabular column, like what is a causative agent and what is a vector and how it will be manifesting the disease. And next, it is an ulcer. Okay, what is the difference between the syphilitic ulcer, Ducrey cancroid, LGB? Okay, so this ulcer topic you want to know. And another is discharge. Okay, regarding discharge is that what is it? Vaginal discharge, cardioid discharge seen in candidiasis. So this 4 tabular column is very very important, and so just go through that. Okay, so again I want to say like you can read whatever notes you are following, but don't skip these topics, that's all. Okay, so friends, again so I will be posting this all topics like which are all the important topics, like I will be making a collective video, and just I will be posting in my channel. So that is for the last minute revision of the microbiology. So before going to the exam, I think the exam is on for Tamil Nadu MRP, it is on Jan 5. So you'll be finishing by almost in December end. So in January you can just go through that video and just you can refresh it. So soon I will be posting that video, friends, and so please don't skip these topics. Okay, so thank you, friends. And again I want to say, and I will be putting some of the important topics like strains in microbiology and immunodeficiency disorders, incubation period of disease in my description box, and kindly go through that. Thank you, friends.